We are live, Chair.
Diolch, Arian. Bore da, pawb. Good morning, everybody, and welcome to our Health and Care Scrutiny Committee. Today, we've got a few different items on the agenda. But before we go into those, just like to welcome officers and cabinet members for joining us. I can see Councillor Sian Cox is online. Perhaps, I don't know whether, I think we've had apologies from Councillor Sandra, and on that note, I will ask you, please, can you give the apologies for the meeting, please, carry on.
Yep, so we have apologies from Councillor Chris Walsh, Councillor Ange Williams, Councillor Glyn Preston and Sharon Powell.
I've also had apologies from Councillor Sandra, who has got another commitment this morning. Has anybody got any declarations of interest to declare? The potential one that I can envisage is if anybody knows anybody who is in receipt of direct payments, although that item is going to be in confidential session. If you know someone who's in receipt of direct payments, I think we just need to note that as a declaration of interest. Not no as in, you know, you're someone down the road, but a direct family member or a close contact. I can't see any. Oh, Gareth. You're on mute, Gareth.
Yeah, I know. Yeah, sorry, Chair. Yeah, just quickly, I'm a trustee of Build Community Support, and we deliver some of the own care packages, which Nina mentioned in, I think it's in Nina's director's report is mentioned.
Okay, we note that. I think that's rather tenuous as the but it's good to note. But as Nina's is to note, as her director's report to note, I think we're okay on that one. Okay, moving on. Anyone been whipped? Any party whips? Disclosure party whips? Nope. Minutes. Okay, we've got some minutes to authorise. Behind the scenes, Councillor Gareth has correctly highlighted that we possibly need to have an exercise whereby we go through all of our action points from those minutes from the last year and have a bit of a tidy up exercise as to whether or not they've been dealt with, update the tracker, and some of those possibly can be signed off, or we might need to follow up on any of those, or there might be some work for us to do as a committee. So just to note that, please. Other than that, has anybody got anything to raise in those three meeting minutes? And if not, please can I have a proposer and a seconder?
I'm happy to propose that we accept them.
Were you at all three of those meetings, Gareth?
I think I may have been, actually.
I'm just going to have a quick look.
23rd of May, I was.
Am I right, Carrie Ann and Kath, that it can't be me? I'm just trying to check whether so we've got Gareth and Carol were in the April one.
Yeah, I was at all three.
All three. Was Carol at all three? Okay, so Carol, are you happy to second the April one? Yeah, okay, that's the April one done. I'm just trying to find the I've lost it.
Councillor Little was at the one in May.
Councillor Little, are you happy to second the May one? I can't see Councillor Little.
No, she's there. Councillor Little is there.
Okay, I'll come back to that one. You got the, oh yeah, she's nodding. Yeah, I've got that. And then the other one, my screen has just gone down. July.
Carol was that, and I think Councillor Little was that as well.
Yep. Are one of you both happy to second those?
Yes, I'll second it.
Great, thank you. Right. Let me just get when I close the document, the whole agenda gets closed. Right. Okay, so those three things are sorted. Okay, so first main item on the agenda is the annual report of the Director of Social Services. Thank you, Nina, for coming to Scrutiny today to present this as Director. We've all had a browse through it, and it's obviously for us to note rather than to scrutinise, but we may just have the odd quick query or question, but I don't want to spend too long on it. So, Nina, are you able to give us just your headlines and also just, I think, highlight really where you see the challenges over the next year for both adults and children's, and also, I guess, it shouldn't always be about challenges, but what have been the biggest achievements that you think have been within those both services this year as well? So we try and be balanced of positive as well as the challenges. And on that note, over to you. Thank you, Nina.
Borodar, good morning. Thank you, Chair. Good morning, everybody. So you've got the report in front of you, and I'll try my best to do a brief summary of highlights, challenges, achievements, as the Chair's just requested. As you all know, I think you're aware of the background of the Director's report, and it's been a requirement of the Director of Social Services from the Social Services and Wellbeing Act. The report itself has been presented to full council in July. It has now just been translated into Welsh as well, so will be published in the next couple of weeks. A copy will also be sent to Welsh ministers and to the Care Inspectorate Wales, and will be published on the Powys County Council's website. What might be of interest to you, committee, is that last year, in terms of translating this report, we had to spend quite a lot of money to get it translated. It's quite a lengthy document. This year, we've piloted AI, an AI tool of translation. So I think that's really quite exciting. And to see this report is one of the first ones to go through that. So it's been a lot quicker and obviously a lot more cost effective for the council. But anyway, I'd like to just go through just a few updates and highlights as requested. First of all, I just want to start by really saying a big thank you to all the staff across social services. Every day I'm just so taken aback by people's dedication, professionalism and resilience. These are really tough jobs in very difficult circumstances, and people, in the services are going over and above to support people and communities in Powys. So I just want to say a real big thank you to everybody. I'm really proud to work alongside everyone. And that includes yourselves, actually. I do find Scrutiny, the support we get from and challenge we get from you, really, really valuable. So I wanted to just say a thank you for that as well. This past year, it has been challenging for social care, and I know you'll all be well aware of that. The national challenges are reflected here in Powys. The sustained demand that we've seen post-COVID, but it's not just the increased demand, it's the complexity. People and individuals and families, it's the complexity of challenges as well that has really increasing costs, in costs of everything that we're having to commission, really increasing because costs for our providers are rising as well. And uncertainty as well. So we continue to work closely with partners across health, education, housing, police, third sector, and others. So that community support is really, really important, and working with our partners to try new ways of working, using new technology, and to also maintain contact and community of care. But despite the challenges, we have seen significant progress and improvement. We are on a journey of improvement. We've aligned our work to the Council's vision, Stronger, Fairer, Greener. We're contributing to regional and national agendas of prevention, integration and collaboration. And we've received positive feedback and recognition from external regulators, inspectors, such as the Joint Inspection of Child Protection Arrangements, which praised our multi-agency partnership working and our safeguarding practice. And really positive, we've reduced our reliance on agency workers and improved staff engagement and retention. So I hope you see that coming through. So in terms of children's services, we've seen improved position over the previous year, continued to implement and revise and update improvement plan, following obviously self-evaluation, etc. There are a couple of key points I'd like to just set out. The key actions for children's services, safeguarding, looked after children, early help and prevention, performance and quality assurance, workforce, commissioning and finance, and participation and engagement. So they're the kind of priorities. Key things to note: number of the children on the Child Protection Register decreased from 309 at the end of March 2023 to 263 at the end of March 2024. So that's a 15% reduction, reflecting improved decision making, risk management, and increased use of alternative plans and interventions to support children and families as well. The number of looked after children has increased from 213 to 236, which is an 11% increase. But just to point out that this is mainly due to increased number of unaccompanied asylum-seeking children that arrived in Powys as part of the UK's government's resettlement scheme. And just want to note the services response across many services and with partners as well to support those young people arriving in the county with appropriate placements, education, health and wellbeing support, and access to legal advice and advocacy. The number of children in need has decreased, a 5% reduction, reflects improved application of threshold criteria and the stepping up and stepping down of processes as well. The service has also enhanced its early help and prevention offer through the development of the family support service and expansion of Flying Start programme. Really pleasing to note the timeliness of assessments has improved, with statutory assessments going from 79% to 84%, which is exceeding the national average. Actually, the national average is 80%. So, you know, that's because of work on workflow management, allocation processes, but also really importantly, increased capacity and stability of teams as well. And of course, a real focus on training and coaching and supporting our staff. Percentage of children who've got an up-to-date care and support plan has also improved, and the percentage of looked after children who've had 3 or more placements has increased, which is slightly above the national average, again mainly due to the increased number of unaccompanied asylum-seeking children that we have received and the multiple placements that some of those have needed. But we've recognised the need to improve, and there's a placement sufficiency strategy and action plan being put into place. Percentage of children looked after who've participated in reviews has improved to 91%, again above the national average. So the priorities moving forward for the current financial year is to continue to embed and sustain improvements in safeguarding practice, continue to develop and implement early help and prevention, continuing to improve the timeliness and quality of assessments, care plans and reviews, continuing to improve placement stability and permanence for looked after children, and to continue to promote a participation engagement of children and young people. One of my personal highlights as director over the previous year has been meeting young people, going out and meeting them, talking to them, listening to them and learning from them. And so, you know, one of my absolute highlights, and I always love to hear their updates as well and everything they're doing. So in terms of adult services performance, we've got information in the report about the contacts, a 4.5% increase from the previous year in contacts coming into the service. And the proportion of assessments completed within the 42 days has improved from 84 to 88%, again exceeding the national average. There's information there on the number of people we're supporting, increase of 3.2%. And adult services delivered significant savings through efficiency measures in the last year, but real note ongoing challenges in terms of budgets and increasing costs moving forward. The service received positive feedback from service users and carers, with 92% of respondents to the annual survey saying they were satisfied or very satisfied. There were obviously ongoing challenges due to increased demand and staff absences, etc. And across children's and adults, there is still difficulties in recruiting and retaining staff in certain key areas and posts, especially in those in rural areas and to specialist roles as well. But we do note the decrease in use of agency, which I think is really important. And within the report, there's a detail about growing our own social workers and the support and training as well, which is something we're very proud of. So the priorities for adult services moving forward, really about promoting independence, well-being, enabling choice and control, supporting carers, improving outcomes for people with complex needs, and strengthening partnerships and collaboration. So we're going to continue to pursue strategic objectives such as developing and further embedding our strengths-based and person-centered approach. Digital and technological solutions are going to be an ongoing priority for us as well, improving data and intelligence, embedding co-production and engagement, and supporting our development and well-being. So Councillor Amanda, I know that was a real whistle-stop tour there, but I think I've picked up on some of the highlights, the challenges and some of the achievements. But just want to note, you know, we've had some really positive inspection reports across adults and children's, which is really pleasing to see, especially of note the JICPA for children's services in education and partners in health and police as well. So a very busy year, a very challenging year, but I think some really positive signs of improvement, but noting that there is of course a lot more to do as well. Thank you, Councillor. Thank you, Chair.
Thank you, Nina. Councillors, has anybody got any queries or questions you'd like to ask? Just to be mindful that, you know, we're not scrutinising the sort of telling Nina to sort of change anything in this report, but if there's anything you would like clarified or anything you just want to highlight that you think it's worth us digging in deep into a bit deeper over the next year. I'm hoping that if one of you puts your hand up, you jump to the front of my list, because I can't see that any of you got your hands up at the moment. Oh, Councillor Gareth, yours has just popped up.
Yeah, just testing the system, Chair. But no, can I just ask Nina a question? I listened to a program, I can't think it was now, on Radio 4 about children with severe life-threatening and, you know, short expected lifespans, and the increase in numbers of children with that type of conditions because of improvement in medical states. It also went on to say that they expect, I think the numbers have gone up by 50% in the last 4 or 5 years, and that they're expecting that to increase again by another 30%. Do you now have any idea if that's going to impact on our services in Powys over the next few years? Are we expecting that increase, and then for those children then move into adult services with that demand of need as well?
Thank you, Councillor Gareth. I haven't heard or seen the programme that you're referencing. I don't have the Powys statistics just off the top of my head. I'm really sorry to kind of know that. We do have Sharon Powell on the call as well, who may know a bit more information and detail that I can. But I'd be certainly happy, Councillor Gareth, to take that away and come back with the kind of figures you're requesting in terms of Powys, and if we have any kind of projections for the future and what the potential impact of that could be. But sorry, I don't have that information just to hand.
Thank
Sharon?
you.
Sharon's got her hand up, Chair, if that's okay. Thank you.
Yep, Sharon. Hi, Sharon.
Morning, everybody. I know I was down as apologies, but I've actually prioritised and come to scrutiny this morning.
Oh, thank you very much.
I was on the apologies, but I'm actually here. A really good question, Councillor Gareth, because I think, although I don't have the statistics in front of me right now to provide to you, but I'll happily go away and we can bring back a paper to scrutiny if that's of interest for you. But certainly the Integrated Disability team, if they were on the call, would be saying, yes, that we are seeing an increase in positive experiences for children's lives because science and medical technology, etc., has improved greatly. So we are seeing children live longer, definitely into teenage years, etc., and probably into adulthood as well. So I think that is naturally progressing in a positive way, but will have no doubt an impact on that kind of service delivery. But more than happy to come back with specifics if that's of interest for you. But definitely we have seen an increase in that in terms of children's services.
I just think it's something we need to take account of when we're looking at the budget pressures for the next few years, really.
Yeah, no, absolutely. And often those children, like you highlighted, are really complex in terms of their individual needs. So therefore, there is a cost attached to that complexity. And yeah, and it's interesting that that's been highlighted on Radio 4, because I think, you know, while science and medicine is progressing, it comes with other complicating factors, doesn't it? Into, like you're saying, about a budget position in terms of managing the complexity. But more than happy to bring a paper back to scrutiny if that's helpful.
Yeah, should we make that as an action point? I think we're not going to be looking at anything between now and end of budget setting process, but maybe sometime in the spring next year, it would be good for us to learn a bit more about this area. But then I think we should also make a note, Gareth, that this is something you have raised in terms of budget impact, so that when we come to look at the budget, if we've got a reminder in our tracker that we just want to, you know, highlight the cost implications in this area, and to make sure that they are sustainable and prioritized. Carrie-Anne and Kath, are you able to pick those up in the minutes for us, please?
Yes, Chair, that's no problem.
And Councillor Sandra, did you want to comment on this as well? Oh, I can't see Sandra. Oh, I can see Sandra now. I can't hear you, Sandra. Still can't hear Councillor Sandra. Carrie-Anne, are we able to unmute Sandra? Does that from our end? I don't know if she's having issues with the sound.
No, I can ask her to, but I can't do that for.
Right.
Here we go. Hi, Sandra.
Hello. Apologies. My battery started to run out just as I was going to speak. So I plugged in now. Yes, I'd like to thank you for that question. I think it's very important, Councillor Gareth, because it's something that might have dropped off our radar slightly, and it's a good red light, basically, for us to be prepared for the future and to take this into consideration. Having worked with MenCap previously, I did see a huge turnaround in the longevity of people with learning disabilities and the complexities of youngsters that were coming through when I was involved there. So it's right and proper that we should take heed of this and be prepared for it, because I do know that the costs will be exorbitant and our schools need to be up to date with it, or we need to have other provision for their youngsters' education and make sure that they have as best a life as we are able to provide as corporate parents. So can I thank you very, very much for that, Councillor Gareth, and I'm sure that our staff have taken note, and I know Nina and Sharon will be on the ball about this, and we can have the stats in the not distant future, and we can all start making the plans and prepare ourselves for that. Diolch yn fawr. Thank you, Chair. Thank you, Gareth.
Nina, thanks, Sandra.
Thank you, Chair. I just wanted to assure the committee that it hasn't dropped off our radar. And just because I don't have the stats on the top of my head, you know, just to assure you that absolutely we're supporting young people and children and their families appropriately, and absolutely not dropped off our radar. And just noting, you know, that it's a really positive thing that young people with these life debilitating conditions, etc., are now having so much more opportunities, etc. So just wanted to give you that assurance. But as Sharon said, we'll be very happy to come back to committee and give you that detail at a future meeting, and would welcome the opportunity to do so. Thank you, Chair.
Thank you. Just got one thing to raise on the sort of that's mentioned as a challenge, I guess, and in the director's report, and that is obviously the unaccompanied asylum seeking children, and we have looked at this in scrutiny before. I know that we had a presentation that was in a private session a while back about how you are trying to make sure that these children can be kept more within POWIS. It would be good, I think, to get an update on that at some point. But I'm also wondering whether, instead of having that as a scrutiny session, given that this is something that is I think it needs to be looked at regularly. I wonder whether it could be as an indicator in the monthly performance reports, whether there could be a section on unaccompanied asylum seeking children. I know we get the breakdown of the different numbers in there, but whether or not there can be some figures as to how many children are what types of placements they're in, and whether those placements are within Powys or without of Powys, and you know, a data set basically, so that we can look at that as in its own right. Is that something we can consider?
Thank you, Chair. Yep, Sharon and I can take that away as an action to look at the performance monitoring and the information we're providing to see if we can provide some more statistics around that. So we'll take that as an action to look at, absolutely. And in terms of something coming back to scrutiny, I think we're down on the December agenda to have another item on unaccompanied asylum seeking children and placements, etc. So that'll give us a chance again with yourselves as committee to have a really good discussion and look at that more in depth as well.
Yeah, okay, great. Right, thank you for that. Let's move on to the next agenda item then. So we have got the Corporate Safeguarding Board activity report. Is Councillor Church attending today, do we know, or has he potentially given apologies?
I haven't received apologies. I have shared the Zoom link with him, but I haven't had any communications.
Okay, not to worry. Nina, are you leading on this then, please?
Yes, I am, Chair. Thank you.
Okay, thank you.
So the report has been provided in advance, and it's the activity update from the Corporate Safeguarding Board meeting, which was held on the 9th of July. And the report is just a summary of the information provided at that meeting. So as always, our first item, we review the progress against actions in the Safeguarding Regulatory Tracker. Now, I know in the past there has been issues with the links not working to the Regulatory Tracker. So what we've done is we've kind of screenshot and snipped the relevant sections into the activity report for you. And hopefully that makes it easier for you to kind of pick up on what the discussion is around. There's 3 items on the tracker from the December 2022 review from Audit Wales. So item number 96, which you'll see is about accelerating the rate of compliance with mandatory safeguarding training for staff and members. We discussed that. We noted the excellent progress that's been made with member compliance, I think was at 100%, and staff compliance being at 95.1%. So we also discussed about how mandatory training is an embedded item now within meetings across the service in terms of performance monitoring, etc. So it was proposed to the board that this item be marked as closed and completed, and the consensus of the board was to agree with that. So that has now been completed. The second item on the tracker is around clarifying expectations of contractors in respect of safeguarding training. We also had a discussion around this. Sorry, excuse me, I'm just moving. It was also proposed to close and complete this item as it had been fully completed in terms of the expectations. Again, the board were in agreement to complete that item. So the third item, and now the last remaining item on the tracker, is around the council assuring itself that all directorates are fully considering safeguarding risks, have suitable escalation and mitigation processes in place. We discussed this and agreed to keep this open on the tracker at the moment, and we would review it at future board meetings. We then, the next item was Regional Safeguarding Board update. We noted that Ceredigion are going to be hosting this year's conference, and the theme is going to be Right Place, Right Time. Conference is due to take place on Thursday, the 14th of November, and if anybody from Scrutiny would like to attend, please let me know, and we can look to send in a couple of representatives from yourselves to attend the conference. It was also agreed that child practice reviews and adult practice reviews summaries be brought to future meetings. and that we have a standing agenda item added to our quarterly meetings, where we take on the learning and a summary of learning from those reviews. So that was agreed as part of that. It's also noted the board the positives of the National Safeguarding Week and the learning and sharing of information from across Powys and with other authorities as well. We then had updates from across a number of service areas. The first was housing. There was a really big discussion about the council's use of bed and breakfast and how important it is to minimise the amount of time that people are spending within these settings and other temporary accommodations in line with the rapid rehousing approach. It was noted that at the end of October 2023, there were 46 households in bed and breakfast, and by the end of June 24, this had reduced to 12, so 74% reduction, which is obviously positive for people and their outcomes, but also it was noted that that's a £20,000 saving per week as well. We also, made sure it was reiterated as a board the need for zero tolerance around 16 and 17-year-olds being placed into bed and breakfast, and housing confirmed that that is absolutely the goal they are working to as well. Assurance was requested from the board that if a 16 and 17-year-old is in education and has to be placed into temporary accommodation, that everything's done possible not to affect their learning. So it was confirmed that wherever possible, the wider needs of the household are taken into consideration, and housing will do their best as far as possible to keep people local when we're looking at temporary accommodation. So, and of course, that would help minimise disruption to learning as well. So really good discussion around that. We then looked at mandatory safeguarding training, which we've kind of briefly touched on above as well, but the detail has been provided in the report for you, broken down by services as well. The board picked up that schools' compliance had dropped, and it was confirmed, the education team confirmed that there was a push and a priority being given to the completion of mandatory training, and that networks had been set up to support governors that have safeguarding responsibilities to help ensure compliance is achieved as well. It was noted that Powys currently sits second in terms of completion of AST and AT training. It was confirmed that Ceredigion have done e-learning module, but we felt that at the moment that would not be appropriate to replicate, but we are looking at what other options can be placed and put into place. Sorry. Adult social care, it was noted a very busy time at the point of this meeting in July in adults, with 5 rapid response meetings having to take place to support. A lot of staff having to prioritise those meetings. One of the things the board picked up on and had a discussion around was the delay in DBS checks and certificates from Dyfed-Powys Police. So each quarter an update is provided from DBS nationally about performance and delays, and it was confirmed that we have been working with colleagues in the police to understand the delays currently, but also the work that's been undertaken to help improve the current backlog of DBS and the delays in those coming through, because of course it has significant impact for when we're trying to recruit both staff but carers, etc. And Powys County Council undertakes DBS checks for other employers as well. Children's safeguarding performance, there was no queries or questions raised, and we then moved on to programme Spotlight on Safeguarding, where a report was presented to attendees. The board were assured about the update provided, and we discussed how else newsletters could be spread further, etc. Annual private fostering report was presented to the board. Private fostering is when a child under the age of 16 is living with someone who isn't a close relative for more than 28 days. And the report set out information on those arrangements within Powys over the last 12 months. It was confirmed that information sharing with Powys Teaching and Health Board was ongoing. In addition, the Children Missing Education pilot that Powys County Council are undertaking with Welsh Government has suggested an annual exchange. So, there will be obviously keeping a close eye on that as that develops, that pilot work. It was also suggested that the annual private fostering report be shared with governors who meet regularly, and it was confirmed that the report was going to be added to the governor's newsletter as well. The JICPA. It was confirmed to the board that the action plan that is being monitored by PLOG, Powys Local Operational Group, and a 6-monthly update against the action plan will be provided at a future meeting. Safeguarding in education, we did join the board, we did run over time, and we didn't go into as much detail as we would have liked to on this one. It was noted that comparative data will be provided in future meetings, and there's also a discussion around if poor behaviour exclusions are being reviewed, if a child receives a medical diagnosis, and education confirmed this is being worked on and support is being provided to schools around ALN. We also agreed that we'd have this item earlier in the agenda at our next meeting to be able to go into more detail. So the next meeting was held on the 12th of September, and you'll get that activity report very shortly. And our next meeting is planned for the 12th of December. I will just note, Chair, if I may, not included within the activity report, is that over the summer we have had a follow-up inspection from Audit Wales on our corporate safeguarding arrangements, and we will be, I expect to have that draft report by the end of this month. So at a future scrutiny meeting and corporate safeguarding board meeting, we will have a report from Audit Wales, an update on our corporate safeguarding arrangements. So I just wanted to bring that to your attention as a scrutiny as well this morning. That's it. Thank you, Chair.
Thanks, Nina. Councillors, any issues you'd like to raise? Councillor Gareth, I know you had a question on the percentages in 2.4. You're on mute, Gareth.
Apologies, Chair. Yeah, just on 2.4, are we happy that the percentages are right? Because to me, it doesn't look right. If you look at the 3 biggest services, education, social service, and economy development and growth, they all have the same performance at 88.8%. And if this relates to all staff, surely the average cannot be 93.5.
I'll have to go and take that away and double check that, Gareth. I do see what you mean though. So I think this is a report that's been run, but I will take that as a way as an action to go and double check that.
Is it that? No, I assume it covers all staff, doesn't it, and members?
It does, yes, it does.
Given the size of those departments.
Yeah, maybe that total figure. Can I double check as an action to double check that, Councillor Gareth? But
yeah, that's fine.
Yeah, thank you.
Any members have any other questions? Nina, I know you mentioned about the home education and exclusions within that report, and that more details will come in following reports. But I just wondered, is there not something that could be embedded or put in there as a live kind of data in terms of, at least so every month you know whether or not there's any new trends emerging, or there's an increase in children going for elected home education, etc. So even if there's not necessarily something that you want to specifically discuss, there's still live information on that, and I still get the sense that numbers of home elected education children are increasing.
Okay, yeah, obviously we've just provided you with the summary of the discussion of the board here, but what comes to the board is that we have a written report from those service areas. So we did have a report at the meeting from the education department, which outlines the numbers, and we can see then any changes, etc., in terms of elected home educated children, for example. So I appreciate we don't provide everything to you as part of our activity report, but if that's a particular statistic that you would like me to include in this report for you moving forward, I'm happy to take that away as an action.
Yeah, I think even if it just says something along the lines of, you know, the percentage hasn't significantly
increase,
changed.
yeah, just the trend, etc. Yeah, no, I appreciate. We did run out of time in this meeting to discuss that in detail. So which is something that we're going to be addressing moving forward, that we might move to 6 monthly for all of the different service areas, because we've got so much to discuss. But that's something that we're going to be discussing at our December board. But yeah, so you want to have a bit of an update on the trend.
And same for exclusions as well.
Exclusions. Okay, yeah, I'm sure Kath and Carrie-Anne will note that as an action. Thank you very much, Chair.
And then my other query is, again, you mentioned on the spotlight, that's the themes of the month, isn't it?
It is, yes.
Yeah,
yes.
and just for the committee's awareness, I was interviewed as part of the audit, and I mentioned that then, and I'll probably mention it now as well, that it would be good, I think, to have a bank where all previous spotlight information is, and I think potentially there's some work to be done on making sure that all members know where that is, all community councils know where that is, all governors know where that is. It's not just disseminated through social media, and it can be looked back on, and it's also timely, because it's a really good idea. And I know you've done them on themes such as children in the workforce and internet safety, but those issues, you know, they don't go away overnight. They are constantly, you know, especially internet safety. I think it would be great if parents and schools knew where they could signpost people to for further information on these types of issues.
Yeah, no, thank you, Chair, and absolutely agree. And actually, we have taken that as an action. And I think we now have a page on the website where we have all of our previous kind of spotlight and safeguarding published.
Oh, great. Okay.
Let me double check. If I can find it during the meeting, I'll pop it into the chat. But you're absolutely right. We need to promote that. So if we could take an action to do a publicity to let everybody know this is where you can find the kind of spotlight and
I think
safeguarding.
especially with schools, because issues may arise where they just may want to say to a parent, you know, oh, have you seen this issue has arisen in school to do with internet use? Have you seen this, you know, perhaps some training that you could access as a parent? You know, the parent might say, how can I find out about how to keep my child safe from certain apps? And I know on that there's links, aren't there, for the parents' guidance.
No, I think it's a really good idea, and when you mentioned it first, so we've actioned it, and I'll make sure. And you're right, we'll make sure we action the promotion of it as well. Thank you, Chair.
Brilliant. Any other members got questions on corporate safeguarding activity report? No. Okay, right. We're now moving on to the child exploitation strategy and implementation plan report, and I believe is Ruth Cross here.
Good morning.
Hi Ruth, welcome to Scrutiny. I think, are you leading on this, or or is someone else introducing it first?
I'm leading, Chair.
And is Sharon meant discussing anything? Is Sharon still here? I can't see Sharon.
Yeah, no, I'm here. Yeah, no, it's Ruth's going to lead on it, Chair,
okay.
And I'm here.
And has Sandra left now? I think she has. Okay, right. Well, I'll hand over to you. Welcome to Scrutiny, Ruth. Have you been to Scrutiny before?
I haven't.
No, well,
we're
not too scary. And if we ask you any questions that you don't know the answer for, we're more than happy for it to come back in writing to us or in the future. And we don't know a lot about this topic at all. I don't think it's been to Scrutiny before. So we'll just hand over to you really, and think we'll go from there. We have planned a couple of questions, but we would be very much led by what you present to us.
Thank you, Chair. Just a note, in terms of what you were just discussing, our team provides parent and community internet safety sessions. So they're actually run through the schools. So we have them in the north and the south. So they're promoted by the schools to all parents and community members who can attend. And we have those actually running in October of this year again. So just to note.
Oh, if we can be provided with the links and how parents book onto that, I think, and I think Does that go out to, obviously it goes to schools directly? Is there a way of it going, oh, it's probably not a way of it going to all governors, is it? But it's just I think it would be great if members had a way of sharing that.
We could look at that though, Chair. You know, Ruth could provide the links to myself and then I'll work out a way that we can share that information. That's not a problem at all.
Great. All right. Thanks, Ruth. Okay, over to you on child exploitation.
Okay, so as I'm sure or hopefully you're all aware, in June 2021, we published our first Powys child exploitation strategy and 3-year multi-agency implementation plan. The vision within it being to create communities that were harsher for perpetrators while safer and non-blaming for children. And we aim to achieve this through strong leadership and multi-agency collaboration under 3 sections. So those being prevent, protect, and to support children and young people's recovery. In respect of that, just to note, in early 2022, our exploitation strategy was then utilised to develop the regional exploitation strategy, and our new implementation plan, which I know is in the papers that you've received, also aligns with that regional document. So in terms of what we've achieved, so broken down, as I said, prevent, protect and support. If we start with prevent, so we invested our time and passion as a team in developing partnership working as the foundations for change. We embedded a collaborative learning approach to support practice and development through what we called the multi-agency community of practice learning sessions. So in total, we've facilitated 17 of those sessions, which have been consistently well attended with positive feedback. And on average, we have between 50 and 80 professionals across various agencies that attend those sessions. And within those sessions, it's about increasing the awareness of different forms of exploitation, but also how they interlink. So thinking about understanding thresholds, supporting parents and young people as partners within assessments, interventions and measuring change. So thinking about that co-production element, but also to support a greater understanding of disruption tactics and also thinking about our responsibility. So, for example, to the Home Office, when we think about the national referral mechanism. And just to say, I think that then also filters into our protect section, which I'll come on to, but our data also recognises increased disruption tactics, following on from those community of practices. So, for example, we've recently had a slavery and risk trafficking order that's been issued in the county. So just as an example.
Oh, what, sorry?
A slavery and risk trafficking order. So that's been issued.
What does that mean? And what does the order mean?
So that's a disruption tactic by Dyfed-Powys Police where there's concerns about an adult and it's about preventing that risk and wider risk to children and young people across the county. We've also made ourselves visible across the county to parents and community members. So we facilitated 12 awareness raising sessions. A lot of those are around internet safety, Chair. Within that, we've also been supported by other agencies. So we've had the youth service, PCSO teams, the college licensing and the Barnardo's counter-trafficking service have also supported us within those. And in addition, we've participated in 8 multi-agency outreach sessions that focus on spaces and places and raising awareness within areas that young people congregate and spend time together across the county. So, for example, on one of those occasions, we communicated with 71 children, which was fantastic. We have also created awareness raising videos for children and parents and carers. So we achieved those by working with the youth service. And I know in the documents it shares sort of how far reaching those videos have been on social media platforms. So 2.4 thousand on the Powys sites, which is really fantastic. And we also reutilize those videos at various times through the year. So we've got Child Exploitation Awareness Week in March, and then we've got Safeguarding Week, which is always in November. We worked collaboratively to secure funding. So that was for an Arad golf production called Crossing the Line. So that was rolled out across all high school sites, and it sparked communication within peer groups. So we recognise that young people influence other young people, so we want to make those messages positive. So that was a really positive drama production across all the sites with positive feedback. In 2022, we introduced our online and in-person parent and community learning sessions, which is what I referred to. Oh, can you, Chair, can you hear me?
Yes, yeah.
Yep.
Okay, apologies. It's just come up to say my internet connection is unstable.
No, all fine.
Oh, great. Okay, sorry. So in 2022, as I said, we implemented those sessions. So digital resilience, which is internet safety, and also child sexual exploitation. So we initially utilised Ystradgunlais School as the pilot for the in-person session, and we had our online sessions. And as I've mentioned, we've got further sessions taking place in Machynlleth and Ystradgunlais in October this year. So just touching upon those positive messages within peer groups that I just referred to. So we know that we can't protect children and young people if we do not understand their perceptions of their experiences and what safety looks like for them. So we attended a Pan Powys sixth form pupils voice group where we had sixth form students consider a child ambassador program that we've put together. So we use their feedback within the development. We've piloted that now on 2 high school sites, and the aim being to now roll that out across all of our high school sites across Powys. So just thinking about secondary socialisation, young people are heavily influenced by other young people. So that work, I think, is really important, and we're working with our schools to get those dates in the diary currently. In terms of the protect element of what we've achieved, so we've embedded our exploitation safeguarding strategy meeting process. So we have that on specific days each week. That is consistently well attended by agencies, which is critical to understand risk, disrupt harm, and meet need for children, young people, and families. We also recognised that the traditional child protection systems created for familial harm don't always effectively address extra-familial harm. So by that, I mean, traditionally, parents and carers haven't attended safeguarding strategy meetings. So we've actually piloted parents attending those meetings as partners, recognising that they are not the form of abuse within the circumstances that we're talking about. So the evaluation of that was positive. Whilst there were professional challenges, it's our opportunity to work through those so that we can routinely support parents to have a voice within those arenas and be actively a part of developing their children's safety plans. And ultimately, within that, I think it's also really important to raise that exploitation impacts everybody within that family and can increase the risk of family breakdown. So it's really critical that they're a part of that journey within their professional network. We have also created a consistently well-attended strategic MACE and implemented a cross-partnership data collection, which again has been a crucial step for us. And within that, I think what's really important as a partnership is that we can more confidently understand the scale and nature of exploitation in Powys, which is a forever changing landscape. So we collect that data on a quarterly basis, and it also then supports us in monitoring the effectiveness of our responses to those children and young people and their outcomes. Within our MACE, we've also developed a much greater awareness of contextual safeguarding. So by that, I mean thinking about spaces and places in which harm can occur. So that remains ongoing, and we also piloted a toolkit where we focused on the space and supporting safe change, and we did that collaboratively with other agencies. In terms of our support elements, so within the team we have 3 child exploitation intervention workers. So along with the prevent strand that I've just spoken about, they also undertake direct interventions with children, young people, parents and carers. And their roles are unique to the circumstances for that child. So the support will vary depending upon what their needs look like. And we've continued to build upon that being a trauma-informed and strength-based service. We routinely meet on a monthly basis with our in-house psychologist, Rob Painter, to support that approach. So thinking about sort of children's formulations, developing confidence within different approaches to supporting recovery, and developing therapeutic letters, which I think is really important because as a service, we value endings being just as important as beginnings. We've also engaged with the Independent Child Trafficking Guardianship Service, which is Bernardo's led within Wales. So they are routine attenders, I should have said, at our safeguarding strategy meetings for children and young people. But we've also then taken the lead in understanding what that service looks like, how that connects with the Home Office and the National Referral Mechanism processes, and ensuring that our practitioners, partner agencies and parents understand what that looks like and the benefits for children and young people. We've mapped out our post-18 support services to aid transition, so recognising that is a process as opposed to an event, but also that no young person is any less vulnerable on day 365 when they gain their 18th birthday cards than they are when they go to bed the evening before. So really recognising the importance of that transition being safe and supporting those young adults to feel secure. So within that, also our data contributed to us starting to think about post-18 toolkits. So one of those being the post-18 exiting prostitution toolkit, which has also been piloted now within Powys. So in terms of our new implementation plan, so I know that that's visible in the papers that you've received. I think it's important to say that we are continuing to build upon what we've identified has worked well within Powys. So those points that I've shared, but also very vigilant and aware to responding to national research and publications to support children and young people. And we've continued to keep those 3 key sections, so prevent, protect and support within our approaches. So the prevent elements is continuing to build upon that collaborative awareness raising, so across communities with parents, carers, children and young people, continuing to develop and embed, or sorry, I should say now embed our ambassador programme within the schools, which I've touched upon, but also continue with our community of practices for professionals and building upon that cross-partnership data set that I've referred to. And using that then to develop other actions as required. So, for example, thematic audits, but also identifying specific training needs. In terms of prevent, again, continuing to ensure that that safeguarding strategy meeting process remains in place for children and young people. But also a targeted focus. So the introduction of the Philomena protocol for missing children, thinking about our unaccompanied children, saw within that what their journey and potential trafficking has looked like, and ensuring that our safeguarding processes are in place, but also how we communicate with those children and young people so that we're not re-traumatizing them potentially if they have been exploited and trafficked as part of their journey. Developing practice guidance to support peer-on-peer harm, and we're also connecting with schools as well, so thinking about what peer-on-peer harm can look like within schools and supporting them within their support to pupils on a daily basis. And continuing to use our data, as I've mentioned, to identify what's working well, potential areas of risk, and then also what we do to understand that and take those next steps. And in terms of our support elements, again, continuing to build upon what we're doing, what our intervention workers are doing with children, young people, the feedback that we receive from those children, young people and parents as well, to ensure that they are, that continues to be a part of our learning journey and our service delivery within the exploitation team. And the transitional safeguarding element also that I've touched upon, ensuring that we're continuing to think about that within our data and support that transition for young adults.
Great. Is that the end of the presentation?
Oh yes, that's the end. A whistle-stop tour.
No, that's great. Thank you. Councillors, do you, Sharon, do you want to just come in?
Okay, just briefly, Chair, if that's okay. Thank you, Ruth, for presenting that. So, the child exploitation strategy is an updated strategy. It has got an action plan attached to that. And for us in Powys, that kind of this area of worry for us in terms of children and young people being exploited does change in terms of methods, the way in which people try and engage children, whether that's online, whether that's face-to-face, whether that's through gang-related activity. So it is something that does exist and has grown in terms of our recognition and observations of children's lived experiences here in Powys, and even our children who are looked after that might be placed around the bordering areas of Powys. Again, we're aware of that, and Ruth does a fantastic job of coordinating all of that information to make sure that we're all sighted on what those risks are. But it's also a really strong focus on multi-agency working, because we can't do this in isolation. So when Ruth was talking about disruption, that means the police are heavily involved in that in terms of tactics to help disrupt that situation of that exploitation, about whatever that means, whether that's online, whether that is a young person meeting up with an inappropriate adult, whether that is gang-related activity. You will have heard of county lines in terms of whether that's reported on the news. Those matters do exist into Powys. So again, it's about making sure that we collate all that information from a multi-agency perspective so that we can then work with that situation for that young person to disrupt that situation as best we can. But it is complex and it's complicated, so we're constantly having to rethink, relearn, readapt to the ever-changing world of social media, internet, technology, etc. So just wanted to add that in. But thank you, Ruth, for taking us through the strategy.
Thank you, Sharon.
Yeah, thank you. Thank you, Ruth. So members, over to you. Who has questions? Okay, I'll just kick off with a sort of a broad question then. And I do have a few others which I'll come back to in case other members cover it. But obviously, child exploitation isn't a new thing. It has existed for decades and decades. However, in your view, has it increased due to children having access to the internet and mobile phones through social media channels and messaging channels?
Yeah, I think our awareness and understanding of sort of what that looks like online has absolutely increased. I also think certainly within COVID, we've seen an increase of online worries for children and young people.
I think the question I'm asking is in terms of those connections that those young people make, where they then lead to exploitation, are those connections generally made through mobile devices and over the internet?
They can be. I wouldn't say that we're seeing that more than any other methods that perpetrators can utilize in person, but it is a contributing factor, and it is something that we are very aware of as a service. And the rationale really behind why we've then developed those parent and community sessions to raise awareness, and those internet stalls that we've also done across the county multiple times, to support those parents in understanding what those risks can look like, but also safety measures. And the videos that we've also created include that as well. So thinking about how we communicate with our children and young people to make online discussions with our children the same as we do when we're talking about children's friends, when we're having dinner with our family. So really normalizing those conversations to try and reduce that secretive element that online harm can bring.
Okay.
Answer your question, Chair.
Yeah, it does kind of, and it's a difficult one to sort of, unless you have kind of data, I guess, to show where the breakdown of the origins of those connections between a child and a perpetrator. But it's just something that I'm particularly interested in. But also the other comment I was going to make just on this topic, that's great that your video had so many views on Facebook, but I just wondered whether you use other social media channels. I know a lot of parents are on Facebook, but what I hear from the kids is that they're more on Snapchat and TikTok these days. So I just wondered whether that is within your reach.
So we haven't got a Snapchat or a TikTok, but how we share our awareness raising is a part of our new plan moving forward to try and keep up with the forever changing social media platforms that children and young people respond to. We do work closely with the youth service, who've got an Instagram, which is really positive. So I know that our messages have been shared through that function. But yeah, absolutely, it's about keeping up with that forever changing social media world.
Yeah, and I think we've got to recognise, haven't we, that there are so many different and new platforms emerging all of the time, and we don't want to be left behind on that platform. So we need to always be reviewing, thinking and considering what are the best avenues to engage with children and young people, and to kind of to put these stories and messages out onto the platforms and media that they would use. So yeah, it's a really good observation, Chair, in terms of that, and it's one that we always need to keep reviewing and make sure that we're running in tune with that.
And also, just to note, that's part of our Child Ambassador programme as well. So that group work that we're rolling out across the county in our high schools as well. So supporting those messages within peer groups and understanding from them where they access their information and their learning, so that we can remain on point in terms of how we then share.
Yeah, what we don't want is it to be a hidden harm, because that we know that just generates more and more complexity in that child's experience. So the more we can promote openness, conversation, encouraging young people to talk to young people about their reflections and learning and observation, etc., the better, really. But it's got to be a multi-agency focused approach to that. It's also, we've got to be in tune with parents and other family members, as well as schools, because it's a lot of it is about promoting that openness rather than keeping that harm hidden.
Yeah, thank you.
Absolutely.
Councillor Gareth.
Thank you, Chair. Yeah, and thank you, Ruth. I really enjoyed your presentation. I really enjoyed coming to a Lammin meeting with you last year and to see the passion amongst the team. Just a couple of quick questions. The first one is, how do you get the referrals? Can a member of the community raise concern with you directly, or do you have to go through another avenue?
So all of our referrals come through our front door. So
Okay.
it's the same process as for any other worry for a child or young person. So that can, of course, be through a community member.
Yeah. And the other question is, are you fully funded by Power? So does other agencies provide any funding towards what is quite a small team?
No, we're fully funded. Ruth's team is
Sharon.
fully funded within Children's Services
Okay.
budget.
Oh, fine. The other aspect I was thinking, Sharon, is I think that a member development session from Ruth and her team would be really good for all members, because it's a area of the service I don't think very few of us know about.
Yeah. No,
And
that's
and I
excellent.
and it can impact so greatly on individuals. You know,
Yeah.
the document, the statement in your report saying that there's 75 children of which you've reduced the risk for 68 of them. You know, that's a fantastic performance in my mind.
Yeah, no, I agree. I think there's lots more we could do with members around raising awareness in terms of Ruth's work, the strategy, the action plan. If in surgeries that members have, if the public are concerned about whatever that might be, that it's knowing and understanding the mechanism for that referral. And we have got a slot for members development in November. So we could certainly add in Ruth's area of work into that development session. So that's a really good idea, Councillor Gareth.
Thank you.
Just to add, Sharon, also, I believe that there's a Members' Day in October at County Hall, and I know as a service that we are going to be present just to share information in terms of what our service looks like. So that isn't a presentation, but we will be available in the foyer for councillors.
Excellent, thank you,
Ruth. Great, thank you. I've got a question on, I guess, you know, you've done some sort of measuring success in terms of reducing the percentage of children at risk, but is there any other ways of measuring how the impact that you're having in terms of reducing that 75 to start with? Is there any sort of other ways of, you know, seeing actually how you've made a difference?
So we gain feedback from the children, young people and families that we work with. So I undertake that following interventions that have happened from my team. The data set includes what those disruption tactics look like as well, that Sharon's referred to. So thinking about, as I touched upon, the slavery and risk trafficking order, which is a first within POWIS, and I think recognising how we are being creative in disrupting adults for not just individual children, but the wider communities in which other children and young people are also present. We have our strategy meetings as well, which is what I've referred to, and within those we're routinely thinking about and triangulating what we understand in terms of what those risks look like, and measuring, you know, has that increased, what do we need to do, or actually has that reduced, and then our data looks at those outcomes, and also, you know, potential re-referrals, for example, back into our service once they've closed, to try and understand sort of what that looks like.
Okie doke. Yeah, I think it would be good to know. Again, I don't know whether this is something that potentially could go on the performance reports, but say you've identified 75 children, but next year that number might have reduced to 50 children, and out of those 50 you've managed to reduce the risk down to, you know, 80% of those 50 for children. So I think it would be good for us to see that, if that is something that you measure anyway.
We do measure it, so we measure it on a quarterly basis, and then we also have an annual report as well, which looks at all of those quarters.
Because I can't see that. That's not in our monthly reports. I don't think it is, but it would be great. Is that something that could go in there, Sharon, maybe?
I think the challenge of the monthly reports, it'll get bigger and bigger and bigger. So we concentrate on the specifics. There might be something though in the annual report.
Okay.
That kind of is that multi-agency reporting data collection that Ruth's talking about. Come in here to scrutiny, maybe, Chair, as a way of just looking at that information.
Yeah. Okay. Happy to be led by you on that. And then my other question, again, you don't need to say about where there are sort of specific trends, but I just wondered whether you do identify certain areas where these children at risk are more likely to be located. And if so, do you do more, so you've talked about working with schools, etc. Is that targeted, or is that across the board? And if there are locations that are more likely to have these children located in them, do you do any targeted support with the local by giving information to the local member or any specific groups there? And you know, how do you address that?
So as part of our plan, we do identify spaces and places. That's part of the contextual safeguarding element of what we do. So if we identify a space, there's different tools that can be utilised. So one of those that we've piloted, which worked really well, is the contextual safeguarding neighbourhood assessment toolkit. So that was considered with a specific space and thinking about what works well within that space, because I think that's really important, but also absolutely what those worries are, what they look like, and what do we need to do to mitigate risks for children and young people. So we do that collaboratively with other agencies. So PCSOs are heavily involved within that. The youth service are heavily involved within that too. And then depending upon the space, wider organisation, so potentially housing could be a part of that. We link with probation as part of that process as well. And we also make ourselves visible within those areas. So trying to understand from that child and young, or children and young people's perspective, sort of what that looks like as part of that toolkit. And then we would monitor referrals, for example, that then come in, identify that space to understand, has what we've implemented reduced those risks, or actually do we need to come back together? Is there something else? Do we need to pause, plan, and maybe think differently?
Yeah, and I would just add, Chair, that in terms of those, so there's a lot of kind of prevention work that happens, but also there's layers that's kind of build up from that as well. So where there might be a hot spot across powers for whatever reason, there would be a more focus on that particular area, looking at prevention, but also looking at that disruption techniques. And then if we're identifying a particular hotspot that involved multiple children, maybe multiple perpetrators, there's specific processes then that would occur and wrap around those particular situations right the way through the organisation. That might actually come up as far as myself if there was a need for that kind of element across a multi-agencies partnership approach. So there's many strands to the I guess the stepping up and stepping down of it all.
Okay, I think that's all my questions. I think in the member development, it would be really good to have a sort of split in terms of what parts of this work are prevention work and what parts of this work is reaction work. I think that would be helpful as well.
Yeah, no problem at all. And we can maybe use it as an opportunity where if there are any particular hotspots currently as a way of kind of promoting with the view of preventing that as well at the same time.
Yeah, great. Any other questions from members? No, thanks, Ruth. It's super informative and interesting. I know it's a really sort of worrying topic, isn't it? But it is, you know, it's really interesting to hear the work that you're doing across and with other organisations as well. So thank you. I really appreciate you coming to Scrutiny today. And sorry to have put more work on your desk for what we want to happen next in terms of member development.
Absolutely. Thank you, Chair. It's a great opportunity, and anywhere we can to raise awareness, we are there. So thank you.
It's okay.
Bye.
Right, in terms of what's next, the item 8 on the agenda is just going to be quite a brief update from me, actually, just so we can just make the public aware of what's going of a agenda item that's going to be on each meeting. There's no report on that, and then we're going to be coming on to the exempt item. I'm just conscious we've been going for nearly an hour and a half, and this meeting's in the diary till 12:30, but we might not go on to that long. Can we just take a 3 to 5 minute max comfort break, please? Just that's a personal request from me. I'm not sure if everyone needs that, but personally I could just do with a 3 to 5 minute comfort break. And what do we do in terms of a logistics on that, Carrie-Anne? Do we just all just mute and take our videos off but leave it live running?
Yes, yeah, I think that's the best way to do it.
I shall see you all back in 3 to 5 minutes.